bath is a local application of moist heat in which the buttocks lower trunk or the pelvic area is immersed in warm water. So it can help relieve pain and discomfort in the perineal area such as after childbirth or surgery, and can increase circulation to the tissue and promote healing. So for assessment, first we have to review any orders related to sitz bath and also to determine the patient's ability to ambulate to the bathroom and maintain sitting position for 15 to 20 minutes. And also, we have to inspect the perineal or rectal area for lake, drainage, test, warmth, and tenderness. Lastly is to assess the bladder fullness and encourage the patient to void before the sitz bath procedure. For objectives, it is to relieve congestion in the pelvis, to relieve painful hemorrhoids, to relieve tenesmus, to relieve pain after cystoscopy, vaginal hysterectomy, vulvectomies, episiotomy during childbirth, and hemorrhoidectomy. For the equipment, we need to have our pitcher for hot water, our hot water bag, the basin, clean gloves and ice cup, and also the bath towel. First, we have to check the physician's order for sitz bath. Identify the patient to ensure that the correct patient receives the correct procedure. For today, can I ask what's your name, please? And your date of birth? We have to explain the procedure to the patient since explanation relieves anxiety and gain cooperation from the patient. So ma'am, for today, I'm going to do a hot sitz bath procedure, and then all you have to do is to cooperate to my what I say, okay? Next is to close curtain around the bed or to close the door if possible. This is to ensure the patient's privacy. Perform hand hygiene and to wear gloves since hand hygiene deters the spread of microorganisms, and wearing your gloves prevents the nurse from exposure to blood and body fluid. So first, we have to raise the lid of the toilet, and then we have to put this basin of sitz bath for sitz bath with the drainage ports to rear and infusion port in front in the toilet. So we have also to fill bowl of sitz bath with about halfway with dip it to warm water. So sitz bath will not drain appropriately if it was placed in the toilet backward. And tepid water can promote relaxation and help with edema, and the warm water can help with proper circulation. So we have to remove the patient's clothing and any dressings that are present, and also assess the area being treated. Next, we have to clamp the tubing on bag. So for example, this is our clump and this is our bag. This is the tube of the bag. So we have to fill the bag with same temperature of water as mentioned above, which is the tepid to warm water. And we have to hang bag above patient's shoulders, height, or IV pole. So if bag is hung lower, the rate of flow will not be sufficient and the water will become full quickly. So we have to assist the patient to sit on the basin, and we have to provide for extra draping in order to ensure privacy for the patient. So slowly unclamp the tubing and allow sitz back to feel. So for example, this is our IV pole. So if tubing is placed on sitz back before the patient sit onto it, the patient may trip over tubing. Filling the sitz back ensures that the tissue is submerged in the water. Clamp the tubing once the sitz bath is full and instruct the patient to open the clamp when the water becomes full. Okay, miss, kung magbugnaw na bala ang tubig, you can open the clamp at the back. Since cool water may produce hypothermia to the patient. And then we have to ensure that the cobble is within reach. Since the patient may become lightheaded due to vasodilation, that's why we have to ensure that the cowbell is within the patient's reach. So we have to instruct the patient to call if she feels lightheaded or dizzy or has any problems. And we have also to instruct the patient not to try standing without any assistance. And also, we have to place this ice cup at the back of the neck or at the head of the patient. So, putting ice cup on the head of the patient will help to alleviate the feeling of weakness. Less amount of blood in the head will cause the patient to faint. Ice cup is applied to cause the blood vessels to constrict in order for the blood to remain on the head. So when patient is finished for about 15 to 20 minutes, help the patient to stand and pat the perineal area to dry. After that, we have to assist the patient to the bed or chair and ensure that the cowbell is within reach. Patient may be lightheaded or dizzy due to vasodilation. That's why the patient should not stand alone, and bending over to dry self may cause the patient to fall. So empty and disinfect the sitz bowl according to agency policy, and to remove the gloves and perform hand hygiene. For cleaning of equipment and hand hygiene deters the spread of microorganisms. For evaluation, there is an increased circulation occurs to affected area. There is an increased warmth occurs to area of application, and the suppuration progresses. The pain is decreased with heat application. So for recording and reporting, record procedure and patient chart, the date and time the bath was given, the temperature of water, the duration of bath, and the effect and reaction of the patient to the procedure. That's the coverage of our head sitz bath demonstration. Again, this is Mary Rosie Garcia. Thank you and God bless us all.